So good afternoon, everyone. My name is Yulika, and today I'll be presenting results from a retrospective cohort study on late preterm birth and growth trajectories during childhood. So childhood obesity is a serious public health challenge, increasing tenfold worldwide since 1975. Obesity in childhood causes both short and long-term effects, including increased risk of premature illness and death later in life. Preterm birth is a risk factor for obesity, with several studies reporting that accelerated postnatal growth in these preterm infants could increase the risk of future obesity. Late preterm birth, defined as birth between 34 and 36 weeks, accounts for 75% of all preterm births, and this fraction has been rising since 1990. There is growing awareness that late preterm newborns are not as physiologically or metabolically mature as term newborns, and that late preterm birth may lead to negative health outcomes across the life course. So a recent systematic review conducted by our team on the association between late preterm birth and cardiometabolic health outcomes found that children and adults born late preterm compared to term were at increased risk of diabetes with a pooled adjusted relative risk of 1.24, and also hypertension with a pooled adjusted relative risk of 1.21. However, late preterm birth compared to term birth was associated with lower BMI Z scores. This finding was not really in the direction we expected, but may have been a result of the wide variability in included studies, including some studies that investigated children as young as 3, while others investigated children as old as late adolescents. Although more evidence is needed, these results hint that late preterm birth and BMI may have a relation, and studying growth trajectories may help us make this relation clearer. So most growth trajectory research is limited to children born term or in preterm children in general, with a lack of studies investigating growth trajectories by different gestational age groups, including late preterm. Therefore, the current study can help determine the link between late preterm birth and cardiometabolic health outcomes. So the primary objective of our study was to determine whether late preterm birth was associated with weight and height growth trajectories during growth periods from early infancy to mid-childhood. Our secondary objective was to determine whether these trajectories differed by sex. To do so, we conducted a linked retrospective cohort study of children participating in Target Kids, which is an open longitudinal cohort which recruits children from pediatric or family care practices in the GTA. So data from children in Target Kids who had weight and height or length data if less than 2 years old, they were individually linked to healthcare administrative databases at ICS. This included the mom-baby database, so a maternal newborn data set, which identifies hospital discharge records for 98% of all births in Ontario, as well as the born database, which was used to identify home births. Data was further linked to other databases and disease registries to obtain confounder data. And the inclusion criteria for a study were children participating in Target Kids and also linkable to mom, baby, and born. They also had to be born between April 1st, 2006 and September 30th, 2014 in order to line up the data cutoffs for ICS and born. Exclusion criteria were the standard Target Kids exclusion at enrollment, which included being born less than 32 weeks, having health conditions affecting growth or severe or chronic conditions, as well as being non-English speaking. People were also excluded if they had an invalid IKN, so the ICS key number, were non-Ontario residents or were not OHIP eligible, had invalid outcome measurement data, were missing gestational age, or were a part of multiple births. The primary exposure was gestational age at birth, and this was calculated based on the best clinical estimate of gestation using a combination of ultrasound and last menstrual period-based estimates. Gestational age was then analyzed categorically with 4 groups defined a priori consistent with clinical definitions, and these were moderate preterm, so less than 34 weeks, late preterm, which is 34 to 36 weeks, early term, which is 37 to 38, and lastly, full term, which was greater than or equal to 39 weeks, and this was our reference group. The primary outcomes were the rate of weight growth and the rate of height growth. And so weight growth was measured in kilograms per month, and then height growth was measured in centimeters per month. And just a note, if they were less than 2 years of age, then we measured the length. And so this was evaluated from 0 to 14 years of age. Weight and height were measured by trained research staff members using standardized instruments and were analyzed continuously. Repeated measures of weight and height were used to then estimate the rate of height and weight growth for each gestational age group through piecewise linear mixed models. And so basically, like, piecewise linear mixed models are separate linear regressions that are pieced together by knot points to follow different regions of data. And so these knot points were determined by using a smooth lowest curve to visually estimate their approximate locations, so the age and months at which growth rates changed in slope in the cohort. And based on this lowest curve, we fit knot points at 3, 12, and 84 months of age, which also align quite nicely with knot points in other growth studies. So in this table here from a study by Howe et al., you can see the different birth cohorts and the knot points used in their different models. So for the knot points for the weight models, they're about 3, 1 year, which is 12 months, and also 7 years, which corresponds to 84 months. And so they corresponded quite nicely with the knot points used in our model. And as a secondary analysis, sex stratified rates of growth were examined to determine whether growth rates differed for boys and girls. All analyses were conducted adjusted for confounding variables, which were defined a priori. And confounding variables included maternal, perinatal, child, and also sociodemographic characteristics. And lastly, missing data was imputed using multiple imputation. And there were 20 imputed data sets that were used. So for the characteristics of study participants, there was a total of 4,423 children included, and they had a mean of 11 weight and height measures per child. Late preterm children were more likely than term children to be born to mothers of non-European ethnicity. Late preterm children were also more likely than term children to be born to mothers that had diabetes, hypertension, or preeclampsia during their pregnancy. And further, late preterm children were more likely than term children to have a lower family income. And also, they are more likely to have a greater history of cardiometabolic disease compared to term children. So regarding growth, the figure here displays the rate of weight gain by different gestational age groups. So generally in the cohort overall, there was a rapid weight gain in the first few months of life, which it became more steady and then increases again after about 100 months or 8 years. And for the gestational age categories, I'll be focusing specifically on late preterm and early term groups due to the interest of time. So the late preterm group is represented by the pink color, and overall we see that weight trajectories were quite similar over time, and slight differences begin to emerge after 84 months. Specifically, late preterm children had a lower rate of weight gain beyond 84 months. This is actually 7 to 14 years. And numerically, the mean difference in the rate of weight growth was negative 0.04 kilograms per month for children born late preterm compared to term. However, there were not really any differences evident for the early term group compared to term. So I'm just zooming in now into this period beyond 84 months so we can see a bit clearer on the differences. And so late preterm in pink has a less steep slope compared to this greenish yellow line. So that's just the early term and term group right on top of each other. So that's really indicating no difference between those two, but there's a slight difference between late preterm and term. And although not displayed here, girls born late preterm compared to term had a lower rate of weight gain beyond 84 months, and numerically the mean difference was negative 0.06 kilograms per month for girls and negative 0.03 kilograms per month for boys. The figure here displays the rate of height growth, and so during the first few months of life, there's a rapid height growth followed by a more steady increase in height. And there was evidence that the rate of height gain was greater in children born late preterm and also early term compared to term from 0 to 3 months. So there's really small period at the beginning of the graph. And so numerically, the mean difference in the rate of height growth for late preterm children was 0.84 centimeters per month and 0.38 centimeters per month for early term compared to term. So here we're just zooming in again on this period between 0 to 3 months, and we can see that the rate of height gain is greater in children born late preterm as the slope of the pink line is greater than the slope of the yellowish brown line over here. And similar for the green line, which represents early term, it's a bit steeper and might also be overtaking this term line in brown past this graph. And although not displayed here, there was insufficient evidence of differences by child sex. So there was one study that I'll be comparing to, which was conducted in 2012 by Boca Tjiritz et al., which found that the median rate of growth was lower in preterm children, as can be seen in these graphs here. So essentially, the lower the gestational age is represented by the rainbow color, and it's kind of going up to purple, but we can see that the earlier you're born, the lower growth you have. However, they also found that the growth rates were actually similar across the different gestational ages. So you don't really see any lines like overtaking the other lines. And so this kind of indicates a lack of catch-up growth. The authors also found that there is greater variability in boys at lower gestational ages compared to girls. This may reflect that preterm boys may be more susceptible to the complications of preterm than girls. So although in our study, we found differences in weight and height growth trajectories in late preterm children compared to term, the patterns also did not really indicate catch-up growth. Our current study did have some limitations, including that we can't rule out residual confounding, and also there's a possibility of selection bias as children were recruited from selected primary care practices. And so the population may not be very generalizable to the greater population in Ontario or even Canada. So overall, the key message of this study was that small differences in growth trajectories exist between children born late preterm compared to term, and extended follow-up is needed to determine if these differences influence obesity risk later in life. And so this is the conclusion of my presentation. I'd like to thank Laura Anderson, as well as my other co-authors and Target Kids, as well as ICS for allowing data access. And thank you so much for listening, and I welcome any questions at this time.